make an eye contact with the camera so that we know that all of the participants are using fair means. So I think you can go for the live screen and Nipshita can start with the introduction.
Okay, so we are live now on YouTube from our end. And to start off with the final event of first year Bonanza, basically, this is Gyrus. And this is the anatomy quiz that we have all been waiting for. And we'll be joined by Dr. Pradeep Pawar, who is presently an educator with an academy. I would kindly like to request Dr. Ayush Bhadani to give a brief introduction and a warm welcome to Sir. Dr. Ayush Bhadani has been the General Secretary of South Asian Medical Students Association for a while now, probably 3 years. And Dada, please, over to you.
Thank you so much, Ipshita. Sir, am I audible?
Yeah, you are.
Good evening, sir. It's my pleasure and my sincere gratitude to have a chance to welcome you for an event on behalf of South Asian Medical Students Association. Sir, I vividly remember my second year of MBBS when I did your first live class. It was a big, huge auditorium. I was scared, but those 3 days were so good, and I could never imagine that someone could teach the entire anatomy, summarize it so beautifully, and just make me fall in love with the subject in 3 days. I still remember, sir, each of your words, things like where are we, bolo bolo bachcho, and they still ring in my ears. And then just getting addicted to the subject, doing it all over again, and then currently making sure to attend all of your Unacademy live lectures. So it's a privilege of all the students in the entire country to learn from you. And so the interest which you bring in the students regarding anatomy is something unparalleled. And so we are so thankful and so grateful to you to agreeing for conducting this quiz. And I just want to let all the finalists know that they are immensely lucky to have you as the quiz master today. And all the viewers who are watching us currently, I would just request you to fasten your seat belts. All the viewers who are there watching us live on Unacademy and Samsa YouTube channels, type in the answers. I'm sure Sir would check the answers and respond back. And just enjoy this quiz. And again, welcoming Dr. Pradeep Pawar, sir. Thank you so much, sir.
Thank you, Ayush, and all the best to all the finalists. So let's crack it. We'll start.
Right, sir. So may I go ahead with the presentation?
Yeah. Please go ahead.
Okay, so I would just like to request my team, the organizers, please make sure to keep a track of the time and the score of all the participants. I hope you can see my screen now. Is my screen visible, sir?
No, it's not yet shared.
Okay, just a second. I'm hoping it's visible now.
Yeah.
So beginning with the first round, sir, will you be reading out the questions and the round details, or should I do that?
You can, no problem. You can.
Okay, so since all of this was like the original PPT was prepared by Atharvada, Atharva Bhaiya, could you please do the honors?
Okay.
Athar, are you there?
Yes, I am.
Please go
Actually,
ahead.
there was some network issue.
Please
Am
go
I
ahead.
audible?
Yes, you're audible.
Okay, so this is the round one, or this round includes clinical questions, and there will be 2 rotations in this round. The first rotation will start from participant 1 and will go up to participant 5, while the second rotation will start from participant 5 and then come back to participant 1. Am I audible?
Yeah.
Okay, so the first rotation will start from participant 1 and will go to the participant 5, and the other one will be vice versa. Each participant gets 45 seconds to answer each of the questions. Ipshita, could you please change the slide, please? So the first rotation, the rules are as follows. Each of the clinical histories will have one question that follows it. If a participant fails to answer or incorrectly answers the question, then the question, a correct direct answer gives the participant plus 20, incorrect direct answer gives a minus 10, a correct pass answer will give plus 10 to the question to the participant who answers the pass question, while a negative 5 will be there for an incorrect pass answer. So I would like sir to please start over with the questions. I hand over it to you, sir. Thank you.
Atharva, you people carry on. I'll conclude the question once the student answers. Okay.
So basically, we'll be showing the question on the screen, and since the time is limited, we will not be reading it out. So the participants are requested to read the question and answer it within the time limit. We'll let you know whether the question has been passed or the time is up. Okay. So on to participant 1, which I suppose is Drishti, right? Drishti, are you ready?
Yes.
Okay. So kindly keep your camera on and keep your audio on so that we do not have an issue. Only the participant to whom the question is directed is requested to keep the audio on. Others are requested to keep it off. So Drishti, here's the question for you.
It's not visible. Slide is not changed.
The timer starts.
It is the case of oculomotor nerve palsy, which supplies all the extraocular muscles except lateral rectus and superior oblique.
Okay, so are you sure about your answer? Should I, sir, will you like
Yes,
to
very
please?
good. So it's a third nerve lesion, the oculomotor nerve palsy. And can you tell me, Drishti, where is the nucleus of oculomotor nerve located? Just as a addition to this question.
In the midbrain at the level of superior colliculus.
Very good, very good. That's a correct answer.
Sir, hello. Sir, I think that it is not the ocular nerve, third nerve. It is the third nerve nucleus which is injured here because there is bilateral superior rectus palsy. If
That is
ocular nerve was gone, only superior rectus would have been, unilateral should have been lesion.
Just come to the fine, but that's fine. Just come to back.
Please show the question again, sir. To sir, Dr. Ratha. Yeah, there is bilateral palsy of superior rectus, not unilateral.
so Shivang is actually correct. If we go to the into the deeper part, it is actually it is cranial nerve nucleus that is having a lesion.
Bilateral paralysis of superior rectus. Okay, fine. Yeah. Third nerve nucleus. Fine. Proceed.
Sir, should I be getting the marks for this? Because there is a difference, subtle difference between the two conditions, right?
Who's asking?
Dr. Athav, are you there? Shivang is there. I'm Shivang Gupta from AMC.
Yeah.
Dr. Athav.
So please could you
Yes,
tell what we should do?
Yeah, there's a bilateral paralysis of superior rectus. What is written here? Ipsilateral paralysis of medial rectus, inferior rectus, and inferior oblique with bilateral paralysis of superior rectus. That's fine. He said the nerve. No, that's fine. The first round.
Yes.
That's okay.
However,
Okay,
the
sir.
question was not passed to
So
Shiva.
the question was not passed to him. It was the first direct question was to Dhriti, and Dhriti gave third nerve palsy and not third nerve nucleus palsy. So could you please tell what we should do with the marking?
Drishti, not Dhriti.
It's Drishti.
Okay, I'm sorry, Drishti.
So no, the person has been passed or what?
No, sir, it was not passed.
No, sir, it was not passed. He just answered in between. He just challenged kind of the question because he thought it was incorrect.
Yeah, because I thought that you were accepting the incorrect answer according to me as the correct answer and moving on with the next question. So there was no option of passing and answering now. So that's why I interrupted in between. I'm sorry for that.
That was the nucleus. That's correct. So then we'll give it wrong. That's fine. We'll put another person if you have any person for this.
So how will you mark for this, Dr. Athar or then Dr. Pradeep, sir?
We'll cancel the person. You put the next person. That's fine.
Sir, Drishti probably answered incorrectly.
Yeah, she answered incorrectly. That's true.
So she gets a -10. And since the question was not passed, Shivang, I'm sorry, but you do not get any marks for this. But thank you for your intervention. Let's please stick to the rules of the ground and go accordingly. So the next participant, who is participant 2, Dhriti, right?
Yes, ma'am.
Okay, so Dhriti, here is your question.
Internal auditory meatus.
That is wrong. Pass on.
The question is passed to participant 3. Participant 3, please.
The stylomastoid foramen.
That is correct.
Yeah, that's
and
He gets a +10.
Right, he also answered within the time limit. So participant.
The injury is at the stylomastoid foramen because lacrimation is intact as well as taste sensations are intact. Correct. So the greater petrosal nerve.
Yes, sir. So
and the nerve to stapedius is intact. And what else was there? Yes. So injury is at the stylomastoid foramen. Correct. That's fine. Okay.
Okay, Pranav, the next question is also for you. So please go ahead.
I can't see it.
Yeah, your time starts now.
No, this is the membranous urethra which has ruptured in the patient.
that is absolutely correct.
Right. So the membranous urethra, correct, lies in the deep perineal pouch. And what is the urethra which lies in the superficial perineal pouch known as?
That is a spongy urethra.
Spongy urethra.
Or penile urethra.
Penile urethra. Okay, or bulbar urethra. Very good. Very good. We can proceed.
Okay, participant 4, that is Dipendu Ghorai. Please see the next question. That's for you.
Yes, ma'am. It's not visible now.
Just 1 second.
Ma'am, it's phrenic nerve.
No,
No.
no, that is incorrect.
The question is
The question passes to the participant 5th, that is Shivang. Please answer.
Shivang, you are on mute. Shivang, you are still on mute.
The root value is T1 root value. T1 nerve carries it from the angina pectoris.
What is the name of those nerves? Those nerves known as which carry pain sensations from the heart.
You want to know that superficial and deep cardiac plexus?
No. Deep cardiac plexus comes later. Yeah. So what is those? Which spinal segment does it come to? The pain from the heart.
That is I'm telling you, the referred pain is T1 spinal segment.
T1. It is T1. In addition, it's something else also.
T1 to T5 is there.
T1 to T5, T4. What is that group known as? What is that known as? It is known as the, yes, can you answer this? Thoracic splanchnic nerves, it is known as thoracic splanchnic nerves, and this comes to the dorsal root ganglions of T1 to T4.
Okay.
And the cutaneous distribution of this ganglion is also the site of referred pain. That's
okay.
correct. That's fine. Correct.
So, do we mark him?
Yes.
Right. Okay. The next question is for you, Shivang.
Yeah.
So,
Please.
here
Proceed.
is your question.
Yeah. The patient will suffer from the lateral pontine syndrome. There will be the syndrome at the pontocerebellar junction on the lateral side.
Yeah, correct. That is known as the cerebellopontine angle syndrome, right?
Yes.
The junction of cerebellum with the pons. That's correct. And you know which structure gets involved in this? If you can just add to that.
The peduncles will be involved, so there will be ataxia involved. Deafness is there because there is the involvement of the 8th nerve, and along with the 8th nerve, there is 7th nerve, so there will be palsy. Actually, these are traveling together in the internal.
One moment, 7 nerves involved. So what will the person complain of?
Left facial palsy. It is written in the question itself, sir.
The entire face, yeah. So what is the type of lesion there?
The nerve is involved, so there is element lesion. So there will be ipsilateral, complete face, flaccid paralysis.
Okay, fine. Correct.
Thank you.
You can proceed.
For the second rotation, the question again starts from participant 5.
Okay.
So,
1 minute. Let me read.
okay.
The rules here change.
Okay.
Each of the clinical histories will have 2 parts, 2 questions following it. The question will have 2 parts. Each of the 2 parts carry 10 marks each, and there is no negative marking here. If a participant fails to answer or incorrectly answers a part or a whole of the question, then the question or the part of that, then the whole question or the part of that will be passed on to the next participant for a +5 marks. But here also there is no negative marking. So the first question goes to 5th participant, that is Shivang.
Yeah.
Get ready.
Please proceed. Yeah.
The time per question is 45 seconds each, right?
Yes, the time limit stays the same for both the rotations.
Yeah.
Okay. Do both the parts individually have 45 seconds, or is it 45 seconds?
No,
for
no.
both
It's
of them?
45 seconds for the whole question.
Okay.
Okay.
So
Thank you.
Shivang,
Yeah, I'm sure. Please proceed.
Try. Try.
No idea, sir. I will pass it.
okay, so the question passes
Uh,
to participant 4.
It has no negative marking. I think Shivang, if the time is there, you should try.
You still have 9 seconds left. Do you want to try?
The best I can answer is there may be tracheoesophageal fistula here. No, I will pass it.
Okay, so Deependu, any answers for this, please? You are on mute. Please unmute.
I think something like that, tracheoesophageal fistula or the esophageal atresia like thing.
Sir, the time is up. So would you please
Right.
enlighten us?
One pass.
Pass नहीं करोगे? Pass it to the next participant.
Pass.
Okay,
Third participant.
participant 3,
Pass.
Pranav.
Pass. Sorry.
Okay, Dhriti. Any answers?
No, pass.
Drishti?
Is it the case of transposition of great vessels?
It is correct. That is correct.
Excellent.
And
Okay.
Okay, that's transposition of great vessels, and that's because of dilatation of the heart.
the left ventricle becomes large egg-shaped.
The left ventricle and the right atrium, they enlarge on either side, so it looks like the egg held in a string appearance. That's transposition of great vessels. Improper formation of the spiral septum.
The developmental cause of this condition? Do we
Yeah.
have any? So I'll give her +5 and +5.
Had Drishti not answered it, I would have taken up and answered that question. I was very curious.
Did she
for it.
answer the developmental cause?
Yes,
I
yes.
don't.
Huh?
Okay.
It's due to the spiral septum rotation.
The spiral septum between in the truncus arteriosus doesn't in one side.
It doesn't spiral.
Yeah.
It doesn't become spiral.
Okay.
Give her a +10.
I did. Okay. So moving on to participant
Yes,
4,
ma'am.
right? So Dipendu, this
Yes,
is the
ma'am.
question.
Is it ameralgia parasthetica?
You are correct.
And the
What is the
cause is
cause?
the compression of the lateral femoral cutaneous nerve.
Yes,
A
correct.
compression. Yeah.
Against what? Compression against what?
Inguinal ligament.
Against the inguinal ligament. So the patient complains of paresthesia, tingling, and numbness along the lateral aspect of the thigh. Correct. That's myalgia paresthetica.
Yes, sir.
I am supposing Dipendu gets +20 for this.
Yes, he does.
Okay. So to Pranav, this is your question.
So the nerve which is injured is common peroneal nerve, and we have the type of gait is we have foot drop here, so there is a high stepping gait.
Yeah.
Correct. So high stepping gait, also known as, what is it also known as, Pranav? The high stepping gait is also known as? Stamping gait. It is also
stamping gait.
Also known as marching gait. Okay, seen in soldiers.
Okay.
Commonly seen in soldiers. Right, correct. That's fine.
He gets a plus 20, Ipshita.
Okay, the next question goes to participant 2, that is Dhriti. Dhriti, are you ready?
Yes, ma'am.
Here is your question.
Right hypoglossal nerve is paralyzed. The right hypoglossal nerve is injured and genioglossus muscle is affected. That is responsible for the protrusion of the tongue. So ipsilateral loss is there.
Yes, so the
hypoglossal nerve, right hypoglossal nerve.
So the tongue is deviated to the same side of lesion. Why? Because the genioglossus.
Ipsilateral.
Yeah, so the genioglossus.
Safety muscle is the safety muscle.
Protrudes the tongue to the opposite side. Okay, that's fine.
Ipshita, she gets a plus 20.
Okay, the next question goes to Drishti. And this is the last question of the round. Next, we will be going on with audience questions. So, Drishti, are you ready?
Yes.
Okay. Here is your question, and your 45 seconds start now. Oops. Sorry, I'm extremely sorry. Here is your question. I'm very sorry about the delay. Your time starts now.
It is the case of varicocele and the veins are pumping from plexus.
Correct. Okay. So it's varicocele and it's the pampliform plexus of veins. Can you tell me the left testicular vein drains into what? Just an addition to this. The left testicular vein drains into
left renal vein.
And the right testicular vein drains into the
directly into the eye.
Okay, correct. We can proceed.
Ipshita, she gets a plus 20.
Okay, so the next questions are for the audience that we have on YouTube. So I would request Sir to please take a look at the live stream. And Sir, the audience will be answering via comments. So please look at that. The first question for the audience is this. A 23-year-old female fell from the first floor and got injured on her left upper limb. So she presented to the ER with extreme pain over left elbow with finger drop of left fingers. It was seen that there is no wrist drop. The cutaneous supply over the dorsal aspect of lateral 3.5 digits and the hand is intact. The X-ray shows fracture of the head of the radius. What is the nerve involved for these symptoms, and which is the muscle responsible for the wrist drop?
Very good. Students are answering. The audience are answering. Yes, the posterior interosseous nerve. Posterior interosseous nerve. Yes. Leeladhar has answered it as posterior interosseous nerve. Very good. And which is the muscle responsible? No, it's not median nerve. The nerve is posterior interosseous nerve. And which is the muscle responsible for extension at the wrist? The muscle responsible for extension at the wrist? The extensor carpi radialis longus, mainly. The extensor carpi radialis longus. Okay. So fine. Students have answered this. You can proceed. Yes, yes.
Okay, so we have another 2 questions for the audience to keep everybody engaged. So this is the next question. A 14-year-old came to the ER with extreme pain in the left foot. She has a history of sprained foot due to skipping 1 hour back, causing an inversion injury. Name 2 ligaments injury to which most commonly can lead to inversion foot injury.
Yes, audiences, you can answer. Students, guess. It's an inversion injury, not deltoid. Not deltoid ligament. It's an inversion injury. So where is the stress? It's on the lateral aspect. So the ligaments on the lateral aspect will get injured. Not the short and long plantar ligaments. They're on the plantar aspect of the foot. The ligaments on the lateral aspect of the ankle joint. Yes, what is that? Liladhar? It's the calcaneofibular ligament. Calcaneofibular ligament, the anterior and the posterior talofibular ligament. If there's a hyperinversion, the ligaments on the lateral side gets injured. And if there's an eversion, the ligaments on the medial aspect of the ankle joint gets injured, and this would be the deltoid ligament. If there's a hypereversion, okay, the deltoid gets injured. Fine. Good. So calcaneofibular ligament. Yes, the answer would be calcaneofibular, the anterior and the posterior talofibular ligament. Very good.
This is a question. I'm sorry for the typing error. The third question is, please identify the following structure.
The arrow is not there.
Oh, right. Sir, if you could.
Just put the pointer. Go up. That's fine. You put the pointer there. That's okay.
This was the structure I'm supposing, as far as I remember.
Yes. That's it. Come still slightly down. That's it. That's
Right.
it. Yes, students, identify this pointed structure.
I'm very sorry, sir. I'm very sorry.
It's yes, anyone? Yes, that's Ayush is answering. Ayush, that's the right coronary artery. That's the right coronary artery which arises from the anterior aortic sinus, and it lies in the anterior atrioventricular groove. So the chamber above the right coronary on the right side is the right auricle or the atrium, you can say, and that is the right ventricle. So that groove is known as the atrioventricular groove, anterior atrioventricular groove. Correct. Very good to all the participants. Very good. So, we can proceed.
Okay, so this is round 2. At the end of round 1, I would like to declare the marks of all the participants till now. Drishti has plus 20, Dhriti has plus 10, Pranav has plus 50, Dipendu has plus 10, and Shivang has plus 30. So we are expecting that, through the next round, you can, go ahead and score more. So for the rules for this round, Atharva Bhaiya, please.
Okay, so then round 2 is the visual round or the image based round. So all the questions will be image based questions, and only one rotation will be there. That means one question per participant, and the participant will get only 30 seconds to answer a question. There will be no passing in this round, and the marking scheme goes plus 20 and minus 10. So the first participant, so the round starts with participant 1. Ipshita, please show the first question.
Okay, so this question is for Drishti, right? Sir, it would be great if we could please read out the questions.
Okay, fine.
Okay, so Drishti, here is the question.
Okay, so this is a cross section of liver. The arrows are marked showing a particular type of cell that are responsible for vitamin A storage. Name the cell.
This is stellate cells of Ito.
Acha, very good. Very good. Correct.
Okay, so Drishti gets a plus 20. Dhriti, the next question is for you. You get only 30 seconds. So this is the question.
Yes, ma'am.
Okay, you have to identify this contents of this foramen. First, identify the foramen, and then you identify the contents.
Foramen rotundum.
Very good. And what passes through it?
Branch 2, yeah, trigeminal branch 2. Maxillary nerve passes through it.
Maxillary nerve. Very good. That's correct. And if you can just add on this maxillary nerve continues as what?
Maxillary. Inferior alveolar nerve.
No. The maxillary nerve continues as what? It comes outside the skull just below the orbit, and this is what we now call as the infra.
Now it's
Intra-orbital nerve. That's fine. That's fine. You've answered it correctly. Yes. Ipshita, proceed.
So the next question, okay. The next question is for Pranav. Pranav,
Yeah.
Name the structure marked by the black arrow. Yes, Pranav.
Mammillary peduncle.
Mammillary
Mammillary body. Sorry.
mammillary body. And
Yeah.
what is that rhomboid? What is that diamond-shaped structure that you're seeing here in which the mammillary body lie?
I mean the interpeduncular fossa.
Right, the interpeduncular fossa. Yes, and that's the mammillary body. Correct.
Yeah.
Correct.
okay. So Pranav also gets a plus 20. The next question is for Dipendu. Dipendu, here's your
Yes, ma'am.
question.
Identify the structure.
That is a sympathetic trunk. Sympathetic trunk.
Very good. That's a sympathetic trunk. And what is its relation to the carotid sheath? Where is it?
Situated on the posterior. It is actually embedded in the posterior aspect of the carotid sheath.
Very good. And something which lies on the anterior aspect of carotid sheath. Can you tell me, Dipendu?
Anterior aspect of carotid sheath.
There's a loop of a nerve which lies
Ansa cervicalis. Ansa cervicalis.
Ansa cervicalis. Very good. Ansa cervicalis. Great. You can proceed.
Okay, so he also gets a plus 20. Congratulations. Shivang, the next question is for you. I hope you're ready.
Yeah.
Okay, sir, please.
Now, what is the exact developmental cause of this anomaly?
So this is, I guess, gastroschisis, and there is the
What exactly is this? Shivang, once again. Something looking similar to you answered it as gastroschisis.
Sir, actually, in the presentation, we get to know that whether there is wall or not. It can be omphalocele or gastroschisis. That can be determined by only by the exact location.
Anything else? Can you determine this by? In omphalocele, it is covered with what? And in gastroschisis?
Amnions.
Amnion. So what do you think is this?
It is filled with water. So I think, yeah, it has, I think, amnion coverings.
Yeah, so it is omphalocele. Gastroschisis will be open. That's fine. But what is the developmental cause of this anomaly? Answer that.
What?
Read the question now. Question is there. What is the exact developmental cause of this anomaly? Why is this caused?
Umbilical herniation.
Sir, the time is up.
He answered it incorrect.
Anyone else? Yeah, is there a pass or no?
Sir, there is no
So there is
pass.
no
We would
pass
like to
in this
open
question,
this,
but people can try.
No, that's fine. That's
So
fine.
this
Anyone
is
wants to answer, you can answer. Anyone else wants to answer?
So it's
this
due to
is
failure of the midgut to return back.
Yeah, to return back into the abdominal cavity.
Yeah, abdominal cavity.
Back to the abdominal cavity.
Isn't it same as umbilical herniation?
It is
No,
due
it's
to
different.
No, it is
No.
not. It is basically it is coming back, but then due to the defect in the anterior abdominal wall, it is going out. That is gastroschisis.
No,
And
no,
this is
but it is due to non-return of the physiological hernia, which
Yeah.
is
Yeah.
that's the actual answer. Okay, fine. You can proceed.
So the exact causes failure of reduction of the physiological hernia. Going on to the sixth question. This is for the audience.
Audience.
Or if anybody from here wants to give it a try?
No, put it for the audience now. Let the audience also have some.
Okay.
Yes, you can answer this. The students, you can answer this.
Dorsal mesentery of esophagus.
Yes. That's a dorsal mesentery of the esophagus, correct. Identify the part marked with red arrow. Yes, students.
Okay. So should I move on to the next question, sir?
Dorsal mesentery of the esophagus, that's correct. Students have answered this. Dorsal mesentery. Right, what else helps in the formation of the hernia? One is the dorsal mesentery of the esophagus. Anything else? The septum transversum, which is a main contribution to the formation of diaphragm, the pleuroperitoneal membranes, and the body wall. Correct? The muscles of the diaphragm are derived from
Cervical oxomites.
cervical myotomes. Correct. Okay, you can proceed. Very good, very good.
Okay. Coming back to more audience questions. Infection in this part of the face can spread to which structure in the brain and cause serious complications? So the figure here shows the dangerous area of the face. We would like to know what the dangerous area of the face is connected to and why does it cause serious complications?
Yes, very good. So this is the dangerous area of face, and infection from this area goes to a sinus inside the skull. What is that? The cavernous sinus. Cavernous sinus. And there are two ways of spread of infection. One is through the superior ophthalmic vein, and the second one is through the pterygoid venous plexus, that the infection goes to the cavernous sinus. Correct. That's a dangerous area of face. Students are answering it very well. Okay, good. Proceed. Name the muscle.
This muscle. Sir, please go ahead.
Its action on the hip joint. Yes, students. For the audiences, name the muscle and its action on the hip joint.
Sir, are the organizers allowed to answer? Please.
Organizers are answering there. Argues is answering. That's psoas major. Very good. And that's flexion at the hip joint. Psoas major and flexion at the hip joint. Can anyone tell me what is that nerve which lies on the psoas major? You can see a nerve lying on the psoas major, students.
GFN.
Genitofemoral nerve.
Genitofemoral nerve, and which is the nerve which is lateral to the psoas major, which lies.
Femoral nerve.
Femoral.
That's the femoral nerve. Excellent. Very good. So we can proceed. Ipshita, proceed.
Sir.
Yes, identify the following structure. Very good, very good. To all the audiences also, they're answering very well. Identify the following structure. Yes, the question is open for the audiences. There are plenty of them watching this live on YouTube. What is that structure? What is that pointed structure? Lateral ventricle is fine. That's lateral ventricle, but something within the lateral ventricle is pointed. Can anyone answer this? What is that structure within the lateral ventricle?
So it is caudate nucleus.
Very good. It's caudate nucleus. It's caudate nucleus. Thalamus nahi hai. It's the caudate nucleus. Caudate nucleus, yes, lies within the lateral ventricle. Right. And thalamus would be there, but thalamus is not seen. Thalamus is on the medial side. Yes, it's seen on the medial side. Inside is the caudate nucleus. Fine. Good. You can proceed.
Okay, so the scores that now stand at Pranav is leading with plus 70, followed by Drishti with a plus 40. Dhriti and Dipendu are at plus 30 each, and Shivang is at plus 20. So this is the third round, the dissection round basically, and it's the last round. So the participant with the minimum amount of scores till now, that is Shivang, gets the first opportunity to choose among which of the parts of the body basically would you like to choose for the question. So you get to choose first. You get 90 seconds to answer each question, including both the identification and the cross questioning. There will be no passing. The marking scheme is plus 20 for correct identification, plus 10 for the cross question. And there is no negative marking, so please feel free to answer. Right? So, Shivang, are you ready?
Yeah.
Sir, should we go ahead?
Yeah, please.
Okay, so Shivang, what would you like to choose? Which part would you like to choose?
One. Head and neck would be fine.
Okay, so you are choosing head and neck, right?
Yeah.
Here is your question.
Yeah, identify the structure. Come on, Shiva.
Answer. This is answer.
With the arrow, with the pointed arrow.
Green arrow, right?
No, with the black arrow.
Okay. This muscle, this is omoid.
Be still specific.
Inferior belly of omoid.
Very good. That's the inferior belly of omohyoid. And what's the nerve supply of this muscle, Shiva?
Omohyoid is being supplied by the ansa only.
Ansa cervicalis. Very good. So that's the omohyoid. And something else, this inferior belly of omohyoid divides a triangle into two parts.
Yeah. Supraclavicular triangle and the occipital triangle.
Okay. Very good. Very good. Ipshita.
Okay, so Shivang gets a plus 30. Congratulations. Moving on to, say we move on to participant 4. So,
Okay, ma'am. Okay, ma'am.
okay, Dipendu, which part would you like to choose?
Abdomen. Abdomen.
Abdomen. Right. So, Dipendu, here is your question. Sir?
Yeah. Fine. Identify the structure. The one with the black arrow.
That is inferior mesenteric artery.
Very good. Inferior mesenteric artery. What vertebral level does this arise at?
L3. L3.
L3. And which part of the gut does it supply?
The hindgut portion.
Okay, very good. Name the artery which is a continuation of this artery.
So once more repeat.
Just see, the question is written there. Name the artery which is a continuation of this artery. There's an artery which is a continuation of the inferior mesenteric artery.
Name the artery which is a continuation of the superior superior rectal artery.
Superior rectal artery. What are the branches of inferior mesenteric? If you can just enumerate first.
The left colic artery, the superior rectal, and
the sigmoid branches. The sigmoid
branches. Sigmoidal artery.
The superior rectal is a continuation. Correct. Okay. Correct, Ipshita. You can proceed.
Okay. So, let's proceed with Dhriti. Dhriti, what would you like to choose?
Ma'am, thorax.
Okay, sir, maybe go ahead.
Yeah, please. Thorax. Identify this structure. Where is the other question? Fine. Identify the structure. Which branch of this nerve supplies the mucus of the larynx above the vocal cord? So now
Is the vagus nerve, and above the vocal cord, internal laryngeal artery. Internal laryngeal nerve.
Internal laryngeal nerve is a branch of which nerve?
Superior laryngeal.
And which arch does it belong to? Very good.
It belongs to the arch fourth.
Laryngeal arch. Okay, good. That's fine.
Okay, so moving ahead with participant 1, that is Drishti, right? Drishti, what would you like to choose?
Supex.
Identify the structure and how many digits are being supplied by this artery.
It's how many digits are supplied to this artery? Ulnar artery, It supplies medial 2 digits.
Ulnar artery is fine. How many digits does it supply? The ulnar artery continues as what? The ulnar artery forms what?
Hello. Am I audible?
Yeah.
Yes, Hello. yes, you're audible.
The ulnar artery continues as what? What does it form? The
It
ulnar
forms the superficial palmar arch.
artery. So superficial palmar arch supplies how many digits in the hand?
Three.
Yes, it's 3.5.
3 digits.
3.5 digits. 3.5 digits. Medial 3.5 digits.
Medial 3.5.
Right? Medial 3.
So, sir, do we mark her for only the first part or the second part as well?
First part.
Okay. So, Pranav, you are the only person left. And the only part left for you is, as far as I remember, inferior extremity. So, are you ready?
Yes.
So, maybe go ahead.
Please. Identify the mark structure, which is the other content of the same compartment of femoral sheath as that of femoral artery.
The other content is the femoral branch of genitofemoral nerve. The marked structure is so that is the femoral artery.
Femoral artery, yes, that's a femoral artery, and lateral to the femoral artery, you can see the femoral nerve. Which compartment does the femoral artery lie in?
Of the femoral sheath, so that will lie in the lateral compartment.
Lateral compartment, and the intermediate compartment is the femoral vein.
Femoral vein.
Correct. Fine. Very good. Ikshita, proceed.
Okay, so we are left with audience questions. And, sir, should we?
This one, audience questions. Proceed. Identify this nerve and name the muscle which is known as graveyard of this nerve. Yes, the question is open to the audiences. Audience. Ulnar nerve. Very good. That's a ulnar nerve. No, that's a ulnar nerve. And which muscle is known as the graveyard of ulnar nerve?
Adductor pollicis.
The ulnar nerve goes and ends in this muscle. That's the end of ulnar nerve, and that is why we call it as graveyard of ulnar nerve. Yes, the muscle is known as adductor pollicis. Adductor pollicis. Very good. So who's answering? Adductor pollicis. The ulnar nerve and the ulnar artery, they pass through the Gyrus tunnel, and they right. So it supplies 15 muscles in the hand. The next, yeah, please. Ikshita, go ahead. Identify the pointed structure, the start structure. Come on, audience, you can answer. First, try to understand which aspect of the forearm is this. Flexor digitorum superficialis nahi hai wo. No, it's a superficial flexor. Which flexor is that? It's a superficial flexor. Yeah. Extensor nahi hai bacha. It is flexor aspect hai. It's not extensor. It's not palmaris longus. It's the flexor carpi radialis. It's flexor carpi radialis. You can see next to the flexor carpi radialis, medial to the flexor carpi radialis is a long tendon. That's the palmaris longus. Palmaris longus. And just before the flexor carpi radialis is the pronator teres. The origin of all this is the medial epicondyle of the humerus. Okay, so the muscle pointed is flexor carpi radialis. Fine. Proceed. Ikshita, proceed. Identify the following structure, the histological slide. Yes, audience, this question is for you. Anyone from the participants?
Is this adrenal cortex?
Adrenal cortex.
Adrenal gland. It's adrenal gland. Yes, it's adrenal cortex that you're seeing. You can see the inverted, inverted C-shaped cells, umbrella-shaped cells. That is zona glomerulosa. Then they become cord-like. That's fasciculata, and then they get into a network that is known as reticularis. Reticularis. It is not Purkinje cell. It is not cerebellum. Cerebellum में 3 layers होते हैं ना, outer molecular, बीच में there's a Purkinje cell, and inner is the granular layer. So this is the adrenal cortex. Fine, very good to all of you. Yeah, proceed.
Sir, that is the end of the slides that we have.
Okay, fine. So what we do is, by the time they sum it up, we'll just take a short viva.
Sir, we'll have to actually go ahead with tiebreaker questions. So please allow me to share the scores till now.
Okay, fine.
And then please hold the tiebreaker round. So the fifth participant, Shivang, has a total of plus 50. Dhriti, Drishti, and Dipendu are all at plus 60. And Pranav is at plus 100. So congratulations, Pranav.
Okay, congratulations.
Thank you.
Sir, please break the tie.
So what are you doing? You're asking some questions, some visual.
I would request you to please maybe conduct a quick viva of 5 questions each for each of the 3 participants, and it can be a rapid fire, sir, and you can give plus 10 and.
So we'll do one thing. I'll put a rapid fire for those 3 of you who are with the tie. Fine.
Yes,
okay.
Sir, that would be the best.
Okay, so be ready. Dipendu, Drishti, and who else is there? Dhriti.
So Dhriti.
Fine. Okay, we'll start. Tell me if it's a horse. You can answer. Jo bhi pehle answer karega, they will get the benefit. Okay. Tell me if there's a horseshoe-shaped kidney, the ascent of kidney is limited by whom?
Inferior mesenteric artery.
Both of them have answered, no?
Yes, sir.
Yes, sir. Please go ahead with the next one.
Okay. Inferior mesenteric artery. That's fine. Tell me which is the first branch of superior mesenteric artery?
First branch of
inferior pancreaticoduodenal artery.
Inferior pancreaticoduodenal artery. Very
So
good.
Drishti gets the one for this.
Right. Tell me which is the ganglion lying in the pterygopalatine fossa?
pterygopalatine ganglion.
This pterygopalatine ganglion is functionally related to which nerve?
Facial nerve.
Facial nerve. And structurally,
Maxillary nerve. Maxillary.
Related to the maxillary nerve. Okay, very good. And this pterygopalatine ganglion, the postganglionic fiber which begins from this ganglion, what glands do they supply?
Glands. Lacrimal gland.
Lacrimal glands.
Only lacrimal, or is there anything else?
Palatal glands.
The lacrimal, the nasal, the palatal,
Nasociliary,
and pharyngeal. Lacrimal, nasal, palatal, and pharyngeal. That's the postganglionic fibers which arise from this. Okay, Fraze syndrome. The Fraze syndrome.
Fraze syndrome, oculomotor, oculotemporal nerve. Parotid.
Auriculotemporal
great auricular nerve gets damaged and its fiber pass to the auriculotemporal nerve.
So great auricular and auriculotemporal.
Auriculotemporal nerve.
Okay, there's a mixing of fibers. That's Fraze syndrome. Okay, fine. That's it. You tell me the anterior choroidal artery is a branch of what?
And internal carotid artery.
Internal carotid artery. Anterior choroidal is a branch of internal carotid artery. Can you tell me there's a deep vein in the brain which is known as the internal cerebral
great vein of
Galen.
Wait. The internal cerebral vein is formed by
the thalamostriate vein, the septal vein, and the one more is and thalamostriate, septal vein, or striate vein.
No. Thalamostriate, septal, and the one which drains the choroid plexus.
And choroidal vein.
Choroidal vein, thalamus right, cerebellum, choroidal vein joins to form the internal cerebral vein, and two internal cerebral veins joins
When with the basal vein and then combines with the formation of the great cerebral vein of Galen.
cerebral vein of Galen. Okay, this great cerebral vein of Galen drains into what?
Great cerebral vein and the in the superior Saja transfer
Straight sinus. Straight sinus. Straight sinus.
straight sinus.
It's the straight sinus, right? It drains into the straight sinus. Correct. Correct. What is the cavity of diencephalon known as?
Cavity of dance on the third ventricle.
Third ventricle. It is the third ventricle. Correct. Right. Tell me, what is cubital tunnels? Cubital tunnels. The nerve involved.
The
Hmm.
cubital, the radial spots compre.
The cubital tunnel syndrome, which is the nerve involved. Just name the nerve. Who answered?
The ulnar nerve got compressed.
Ulnar nerve.
Drishti answered first.
Fine. And just tell me one more thing. What is chiralgia paresthetica?
In the anatomical nerve box, there is a compression of the superficial branch of radial nerve.
Very good. That's a superficial branch of radial nerve which is compressed. Okay, Ipshita, you can go ahead. This is fine.
Sir, can we have one more question between Drishti and Dipendu, please?
Drishti and Dipendu. Huh? Okay, be ready. Tell me, which is the ligament which supports the medial longitudinal arch?
Medial longitudinal.
Spring ligament.
Very good. The other name for spring ligament, Drishti?
The spring is plantar
calcaneonavicular
ligament.
Plantar, Drishti, answer it first. Ipshita.
That was amazing, super fire, rapid fire rounds. Extremely enjoyed it. And congrats to Dipendu, Drishti and Dhriti for this amazing answering, and it was very good. And Ipshita, please.
Sir, last round ke liye, would you want to give the marks to Drishti or Dipendu?
The last question was answered by Drishti, no?
Yes, sir.
Right. Okay, so we will be having Pranav as the winner. Drishti is the first runner-up and Dipendu will be the second runner-up, followed by Dhriti and Shivang.
Okay, for Pranav, a short viva fast. A faster viva. Pranav.
Yes, sir.
Okay, be ready. Ek thoda sa for 2-3 minutes we'll start. Right. Tell me, which is the nerve which pierces the coracobrachialis?
That is the musculocutaneous nerve.
The musculocutaneous nerve continues as what?
Lateral cutaneous nerve of the forearm.
Lateral cutaneous nerve forearm. Yes. What is intercostal brachial nerve? It's a branch of which intercostal nerve?
Second intercostal nerve.
Joins with what?
I'm sorry? It joins with the medial cutaneous nerve of the arm.
The medial cutaneous nerve arm. Which are the two nerves which are present between the axillary artery and the axillary vein?
Axillary artery and the axillary vein. So we have the medial cutaneous nerve of the cutaneous nerve of the forearm and the ulnar nerve.
So who's above and who's below?
The medial cutaneous nerve of the forearm is above.
Yes.
Ulnar nerve is below.
Ulnar nerve is below. Okay. Tell me, at the wrist, if I have to search the medial nerve, I search it between two tendons. Which two tendons?
Right. You will search it between the tendon of the flexor carpi radialis and the tendon of the palmaris longus.
Excellent. Tendon of flexor carpi radialis and palmaris longus. Very good. Very good. Tell me one muscle in the hand which is a composite muscle.
Flexor pollicis brevis.
Flexor pollicis brevis is a composite.
Receives dual innervation from the deep branch of the ulnar nerve and the median nerve.
Okay, one muscle in the femoral triangle which is a composite muscle. One muscle in the floor of the femoral triangle. Composite muscle.
So we have.
Is it pectineus?
Pectineus.
Pectineus, sorry, yeah.
It's pectineus, correct?
Right.
The posterior division of obturator nerve supplies two muscles. Name.
Obturator externus, adductor magnus. Even it also supplies the adductor brevis if it is not supplied by the anterior division of obturator.
It supplies the obturator internus.
Operator internus, nerve to operator internus, which will arise.
Where have you come across this nerve to obturator internus?
Nerve to operator internus, those three structures which first pass through the below the piriformis, through the gatosciatic,
Fine. They wind
then back through the.
They wind around the ischial spine. They wind around the ischial spine. Very good. So, which is the nerve of the perineum?
That would be the pudendal nerve.
Pudendal nerve. And the artery of the perineum?
Internal pudendal artery.
Pudendal artery is a branch of?
Internal pudendal artery is a branch of. Anterior division of the internal iliac artery.
Anterior division of internal iliac. Very good. Tell me, median sacral artery is a branch of what?
Abdominal aorta, direct branch.
Dorsal branch, ventral, lateral, anterior. Select any one.
I have to select from dorsal, ventral, and
lateral
dorsal branch. It's a dorsal branch.
It's a dorsal branch. Tell me the lateral branch from the abdominal aorta. First lateral branch.
First lateral branch would be the one is renal artery.
No, first lateral branch of abdomen.
Inferior phrenic.
Very good. Inferior phrenic artery. That's very good. That's inferior phrenic artery. And this superior epigastric artery is a branch of what?
So superior epigastric artery would be a branch of the
terminal branch of internal thoracic.
Thoracic.
Other branch is musculophrenic artery, right?
Terminal branch of internal thoracic enters the abdomen through a small foramen. Name?
Foramen of Larry.
Foramen of, that's a space of Larry, also known
Mogagni.
Yes, and there's something known as sinus of Mogagni. Where does it lie?
That is between the upper concave border of the superior constrictor muscle and the base of the skull. Sinus of Mogagni.
Very good, very good, very good. Right. Can you tell me the Papis circuit? The
Papis circuit.
Course of the Papis circuit. Where do the fibers begin from and where do they end into?
So from the hippocampus through the fornix, it will go to the anterior nucleus of the thalamus. Then,
so from the hippocampus, the fibers begins. That's a alveus. Alveus ka fimbria banta hai. Fimbria ka fornix banta hai. Fornix comes and goes to the mammillary bodies. From the mammillary bodies, they go to the thalamus, right? Anterior nucleus of thalamus. That's the mammillothalamic tract. And from the thalamus through the cingulate gyrus, they go back to the hippocampus. That's the Papis circuit. Okay, and this is responsible for emotion and recent memory. Okay, very good. So congratulations to all of you for participating in this quiz. And very good. You'll be, good, and you'll be having a good knowledge of anatomy, and you can apply it to your clinical practice, clinical subjects also. Very good. Vikshita, take over.
Sir, I do not have any words. I'm just thrilled, and I just barely stopped myself from answering because the Viva was that interesting. So, Ayush Bhaiya, the smile on your face says something.
Vikshita, it reminds me of my first year MBBS anatomy final MB Viva, and it's amazing response by all the participants, and Pranav deserves this, and he's very good. And I would just say that Pranav, I'll be eagerly waiting for you in the live classes of Pradeep sir every day on an academy, so that we can together answer sir's questions.
Very good. All the participants have answered very well, and even Drishti, Dipendu, Dhriti, and Shivam, no? Shivam.
Yes, sir, Shivam.
Yes, sir.
Very good to all of you.
So I would just request you to maybe say a few words for the first year MBBS students from our organization and also from other like an academy who are going to face the first year MB practicals, and maybe some learning points on how to approach it, and so that they can be better clinicians and also learn good anatomy.
Okay. Learn to give good bypass. You study everything and have small group discussions. You form small groups and you ask questions to your friends. And the way like you were answering, if you were not able to answer, the other students were answering. So writing theory is very easy. You can, you just have to read. You can write the theory, but answering the vivas is very particular and very specific to the point. So practice that, and it is not difficult. The more you practice, the more you will be, good at it. I've seen Ayush attending the lectures, and now is very good, excels. Okay, like all the students, the more you attend the lectures, you will exceed in your subjects. Okay, thank you. Thank you.
Thank you so much, sir. We really look forward to more collaboration with you and have you as one of our educators, like guiding figures for South Asian Medical Students Association, so that even our future members can be benefited and learn anatomy and other life skills from you, sir.
Okay, thank you to your organization, the SAMSA, and all your team members. You have been really cooperative, and it's a great team effort. Thank you.
Thank you so much, sir. And sir, on this occasion, I would also like to thank An Academy for collaborating with South Asian Medical Students Association and giving us the opportunity and helping us with the amazing educators, be it Shanmugapriya ma'am or Dr. Kaur ma'am or Dr. Pradeep sir. And I would request, and I would also like to congratulate and applaud all my juniors, Ipshita, Atharv, Shagufta, Shauridipto, and all the people who have been extremely working hard for this three amazing quiz events. And I also would want to request all the participants and all the viewers who are watching us to keep a track of the upcoming future. On this, I would like to end this session and also request Ipshita to just end this by saying a few words. Thank you so much.
Bhaiya, I would please like to play the video. May I?
Yes, yes, please, please. So we would like to play a video of South Asian Medical Association.
No problem. Go ahead.
Okay, so just a second.
And Aish, Dekho.
Yes, sir. I think we can end the session for now. And thank you so much, sir, once again.